Hello everyone. If you are watching this, please be aware this was filmed starting almost a year ago. So if you want to come in the comments and try to talk me out of it, you're like 9 months too late. So I thought a lot about how I'm going to upload this. It's over 2 hours long. And I know a lot of people aren't going to want to sit and watch 2 hours of it, but some people might. I mean, I like vlogs. I like, to put stuff on in the background while I'm working and stuff like that. Yeah, I am 9 months post-op at this point. I am so glad that I did it, even though you can see like I'm really out of it. I was nervous, but it's seriously, for real, so worth it. It's 2026 and January, so we're almost a year to when my consult was. My consult was on January 19th of 2025, so we're on 2026 now. January the 12th is when I'm filming this, so that's where we are. That's what we're doing. I'm gonna just upload this whole thing right now, and maybe I'll split it up into like the decision making, the consultation, the pre-op appointment, day one post-op, and like maybe I'll break it down from there, but I cannot promise anything at this point. Let's just be realistic. Like, who am I fooling? So without further ado, here is my 2-hour-long vlog about getting a breast lift and augmentation. Okay, let's flash back to the past. Woo! Hello friends, it has been a very long time since I put out a video. A lot has happened, and I actually have filmed several videos that never got edited. They're just kind of living on my computer, but I wanted to come on here and let you guys know that I am going to be having a boob job. I mean, I already have a boob job, as a lactation consultant, but I am going to go for a breast lift and augmentation. I have already scheduled the surgery, and I wanted to kind of document the process. I've been watching a ton of vlogs about other women's experiences, and I find it to be really, really helpful. A few things that I think I would be able to talk about, speak to, that maybe they were not able to, would be the effect of, lactation and future lactation when you have breast surgeries, because a lot of them were very young women having these breast surgeries. Some of them were saying they wouldn't be able to breastfeed. Others were saying that their surgeon said that they would be fine. So I wanted to be able to talk with you guys about that. And also, my, last couple of years, stuff that's been going on. I did finally wean my last child in November. And, at that same time, like the few months before that, were super, super stressful. I was very depressed. Lots of stuff going on, like work-related stuff, and it was just a really tough time. So I lost a lot of weight. I was, I've been working out, I've been lifting, I've been focusing on getting a lot of protein, because those are my goals, like getting stronger, getting healthier. And I was gradually losing weight and building muscle throughout the whole last year. But when I started this new job in August, lifting kind of went by the wayside. I stopped tracking my protein about a month and a half in. And the stress, and just all of it, like I dropped weight very, very quickly. And at the same time, you know, weaned my child. And so my boobs have completely deflated. It wasn't like that after, you know, my first two. They kind of rebounded just fine. But also I had not lost a ton of weight at the same time. So, they're very, very tiny. Like, where are they? There's nothing there. Nothing. Very, very small. And I love the way that the rest of my body looks. I think that I look really strong. I am keeping track of my protein again. I'm eating well. I'm lifting. I'm being active. I am way less depressed. I can't say that I'm not like 100% not depressed, but you know, we're working on it. And I'm taking better care of myself. So I feel like, you know, when you add it all up, all of the years that I spent breastfeeding all of my children cumulatively, it's like 11 years. I'm 34. 11 years of my life, a whole third of my life, I have spent nourishing another little human with my body. And when, you know, my last baby weaned, baby, toddler, preschooler, I felt really weird. Like, I'm happy to not ever have any more babies ever again. But it's bittersweet. Like, I was so ready to be done nursing, so ready. Like, it's just crazy that my body is like mine again, and it hasn't been for so long. And because I became a mom really young, my body has just been pregnant and nursing and pregnant and nursing and pregnant and nursing for so many years. It's like I get to finally be who I am when I'm not sacrificing my body. And it's just really strange. It's definitely an adjustment. And I haven't been taking a lot of lactation clients. I was just really burned out. And I still, you know, I'm kind of burned out. But I remembered that young devastation, right, you know, after having my first baby, I thought, when I'm all done having kids, I will definitely have a boob job and definitely have a tummy tuck. And I kind of, like, I would say that on and off, you know, hoping that that could be real, but realistically thinking there's no way I'd ever be able to afford that. You know, I grew up watching like Dr. 90210 and, you know, plastic surgery shows like that, and I loved them, but I never really thought that I would actually be able to do it. And then I remembered that. I started thinking about it, started thinking about getting a breast lift and an augmentation, because like none of my bras even fit. Like, even if I get what is technically the right size for me, I can't fill out the cups. They're just very like deflated, for lack of a better term. Like there's nothing there. So I started thinking about it, doing some research, looking into it, and then I saw an ad for a local plastic surgeon on Instagram, and they were offering a free breast augmentation consult day. Generally, their consults are $90, and then if you book the surgery, they would apply that to your total. So it would just be like wrapped in. So I called, I scheduled the consultation. I went, and she, you know, measured me, all these different, like from here to here and here to here and there to there. And she said that she definitely would recommend a lift in addition to implants, because the way she explained it is, if she didn't do the lift and we put the implants in, while it would fill out the tissue that is there, over time that tissue will slide down off the implant. And she said it's called like a waterfall effect. So you would have like the implant high up here, but then breast tissue like hanging down underneath. And that's not a good look. It's not something I am interested in. She said that the extra scars are worth it. She said that it's going to be an anchor scar. So that would go around the nipple, down underneath, and across. Now, I don't know how far the incision underneath is going to go, like if it's going to go like out to my armpit. I'm not sure about that yet. I have to still go to my pre-op appointment, which is in 5 weeks, and I'm so excited. And that's where you get to like try on the different sizers and see what size implants you want to go with. At the consult, she also took pictures and loaded them to a like 3D simulator software, and, you know, chose different sizes to simulate like what it would look like on me. And it was really, really cool. And like she started out with like 500 cc's or something, or 550, and a 600. And I got home and I was looking at them and thought, why not? Like, they don't look that big. Like, if I'm going to go for it, if I'm gonna have a boob job, it's not gonna fool anyone. Why go for natural? Like, just give me the boob job look, you know, like, love it. So why not embrace it, you know? So I asked her if she could show me some like slightly larger ones, and she sent like a 650 and a 750 or something. I'm like, these look great. And it's really funny watching all these vlogs of different women and say like them saying what their CC like implant sizes they got. They vary so much, and like some women are getting like less than 400 cc's and their boobs look gigantic. And I'm like, my doctor's starting me out. Like the smallest size she gave me was like 550, and they didn't look that big. like how little tissue do I have here? Very little. I have very little tissue. Another thing that a lot of these vlogs have not shown, that I am going to do my best to show, is the bruising afterward. None of them have shown a lot of like the incisions, And I think that I can probably figure out a way to do it in a way that covers the nipples so that YouTube doesn't get angry, but shows you realistically what it's going to look like afterward. Because I feel like, for me personally, I'm so much more prepared when I can see something and know generally what to expect. Like, I know that everyone's experience is different. You know, some people bruise really bad, some people don't, some people scar really dark, some people don't. But I feel like the more you can see, and I feel like this about birth too. Like when you're pregnant, just go watch all the birth videos, C-sections, like medicated births, hospital births, out of hospital births, all of it. Go watch all of it so that you are prepared as much as you can be. So that's what like I'm doing with these breast surgery videos. I just want it to be educational and helpful. We can also talk about the effect of breastfeeding on breasts and the effect of breast surgery on breastfeeding. It's a lot. Whether or not you'll be able to breastfeed your child after a breast surgery depends on so many different factors. It depends on the type of incisions your doctor is making. It depends on if they are removing tissue and how much they're removing. It depends on any scar tissue that is left in the breast, and whether that's going to affect your milk ducts. It's, you know, if you don't have sensation in your nipples, your brain might not get that signal to release milk. So while the milk may come in for you, you might not be able to like release it and continue producing. There are nerves in the breast that are about here-ish that if they are severed, it's going to make it very difficult to produce milk because your body is not going to get those signals. Your brain's not going to be able to get those signals from your body and vice versa. So there's just so much that goes into it. Generally, breast augmentation, you should be able to breastfeed. With a breast lift, again, it depends on how they do it, how much tissue they remove, and how your nerves kind of grow back around your nipple, because they do kind of take your nipple off and move it up. So, it really depends. The same with a breast reduction. They're taking your nipple off, they're moving it up. They're removing a lot of tissue. And so whether or not you are going to be able to produce a full milk supply after a breast reduction is really up in the air. And that's something to, you know, work with a lactation consultant, you know, about. That being said, I have never met a woman who had a breast reduction and regretted it. And even when they went on to have children afterward, like after their surgery, even if they weren't able to produce a full milk supply, they were still able to nurse their children partially. And I've never heard anyone say that they regretted having a breast reduction ever. Breastfeeding and your boobs. I used to be totally in the camp of breastfeeding doesn't make your boobs saggy. And like, it didn't for my first one, and not really for my second one either. Like, I feel like the really don't sit lower than they have. You know, after my third, like, they're just completely deflated. Like the way they decide whether your breast is saggy or not is if your nipple is above or in line with the inframammary crease, so the line under your breast. So if your nipple is above that, like from the side, then it's not considered like that you have a saggy breast, ptosis. Mine was right like at that line. All the fullness was at the bottom, like lower pole. And it's kind of like a pseudotosis. But because there's just so much skin and it's so deflated, like it just makes more sense to have the lift, have the breast sit nice on top of the implant, which will be under the muscle, and just have them be nice and up and high and where they're supposed to be. And you know, it's not even that I didn't like my body, that I don't like my body. I love my body. I'm super happy with it, actually. For the first time in my life, like I really, and like looking back over the past year, I've been really happy with my body. I've been getting so strong and fit and healthy, and like cardiovascular, way healthier, you know. But I just feel like I can't fix how my boobs look on my own. Like it looks very bizarre when I'm, you know, wearing clothes, because like I don't even fill out my bra, you know, and I'm very, very small chested at this point. And it just, I feel like I can make the rest of my body look how I want it to look for the most part through lifting heavy, working out, eating lots of protein, you know, all the things. But like there's no exercise you can do to make your boobs fuller. And like I told my mom, I'm not going to go gain a whole bunch of weight just to make my boobs look bigger again, because even at that point, who knows what they're gonna look like. So I actually got like a second, third, fourth, whatever extra job. I got an extra job, and I've been working and working and working and working so much specifically to pay for this surgery. So I can break it down for you, the cost. So the surgery center, an anesthesiologist, and pre-op testing are all billed separately. And then the surgeon's fees are separate from that. So, okay. So after my consultation, I didn't immediately book the appointment. They gave me the proposal of what like the cost breakdown and everything would be. And that proposal was good for 6 months from the consultation, meaning like those prices are locked in. It's not going to go up. And I would just have to book the surgery within that 6 months. And the surgery itself wouldn't need to be within that 6 months. It would just need to be that I've booked it within that 6 months. So I got this other job. Like I already had it. No, I didn't. Silly me. I got this other job. I'm losing it. I got this other job and like threw myself into it. And I was like, if I can make $1,000 in a week, then I can book this surgery. And I did it, and I was shocked. Now every week is not like that, The work comes and goes. It's task-based. But I was like, I can do this. I started paying down my credit cards like a responsible grown-up, and started saving. And once I had enough saved for the anesthesiologist surgery center pre-op admission testing, that total, that's when I called and scheduled it. And I had like so you have to, when you schedule, put down $1,000 deposit. So I had all that saved up before I called and scheduled it. So the surgeon's fees, $9,121 for a submuscular breast augmentation and mastopexy with silicone implants, 2.5 hours. The all-inclusive surgeon fee includes Dr. Greer's professional fee, equipment and implants, post-operative garments, and post-operative visits for 1 year. So she's actually told me all of the follow-up visits are included. The pre-op visit is included. Everything is included in this fee. 2 surgical, like post-surgery bras, the scar gel, and she even said, like, if you need like laser scar treatment or anything like that, all of that is covered with this fee, which I thought was kind of amazing. And she recommends getting, you know, the ultrasound on the breast just to make sure everything is good, like that the capsule hasn't opened or anything like that, at a year, and then like 3 years, and just to keep an eye on it. And she said all of those are covered. Like, you don't have to pay anything. And I think that's just amazing. And definitely worth it. So the facility fee for the surgery center, $2,158. The anesthesia fee, $1,333. And the pre-admission testing fee is $150. So that total comes to, putting it all together still kind of gives me like heart palpitations. Like, that's a lot of money. But I got a second job for it. So like, I'm allowed to do things for myself. $12,762. So that's a lot. It's a lot. But I think that it's going to be worth it. I think I'm going to be really happy with it. I really like the doctor. Her name is Dr. Greer. She is out of Cleveland, and she makes a lot of super informative videos on Instagram, probably TikTok. I don't have TikTok, but whatever. She's really personable, really sweet, really knowledgeable. She right up front gave me all of the risks and potential risks, talked about breast implant illness, the risk of cancers, and she said that the risk of cancer from breast implants is specifically from the textured implants, and she said that they don't use textured implants anymore, like at all. So she said that risk is low. There's always risks with any surgery, with putting any foreign object in your body. But she like was so open and transparent and just offered up all this information to me. And I really respected that. I really like the informed consent. I like to have all the information. I think it's so important. And like, especially with my background as a doula, like that is all that I want for every person ever, is to have informed consent about what they're doing with their bodies. I want you to know what's going on. I want you to ask questions. I want you to know all the pros and the cons, all the risks, all the benefits, you know, and be able to make an educated choice. That's where I am. I feel like I probably said I was going to talk about something else and didn't. I think I'm gonna just put out one really long video after everything is done, because that's how I prefer to watch my content. It's just, don't make me look for more videos. Don't like make me click around. I want to watch one video beginning to end, like cinematic movie length. Give me all of it. So I think that's what I'm gonna do. So I just wanted to let you guys know I'm going to try to get some safe for internet pictures of what my boobs look like now. So it's been more than a week since I filmed last, and my SD card ran out of space, like right at the very end of what I was saying. So since then, I have learned some things. So I said that they like take your nipple off for a breast lift or a breast reduction, and it turns out it's like not. I watched a procedure. Like maybe you shouldn't seek out the actual like surgical procedure and watch that, but I did. So that was a little scary. But at the end, like the results looked so nice. It's like, it's worth it. So what they do is they cut around the nipple, but they leave the nipple like attached to these structures inside, like with the milk ducts and everything like that. So they leave the nipple kind of attached, but they cut the skin around it. And then they, you know, kind of like move the skin and tissue down and around to lift the breast up, and they sew the nipple in a higher location, basically. So I wanted to clarify that. Don't want to be, you know, misinforming anyone. And generally the nerves kind of can grow back. They can kind of come awake again. So all of those things kind of play into whether or not you'd be able to successfully breastfeed after a breast lift or after a reduction. Now, I've seen a lot of vlogs where people are saying that their doctor told them they had to be done nursing for, like the range was so wild. It was like at least 3 weeks, at least 3 months. My doctor told me 6 months. Just because the breast is very active, you know, when it's lactating, and that's not something that you want to mess with. Basically, you don't want to be dealing with milk and milk ducts that are actively producing milk while you're cutting into a breast. So the 3 weeks, like that's crazy to me. Even 3 months, it takes a while for all of your milk to really be gone. 6 months makes a lot more sense to me. And that's, you know, what my doctor recommended. So we're going to be perfectly like at 6 months by the time I have my surgery. Another thing that I have been seeing in a lot of the videos and a lot of comments on the videos, like I know you should never read the comments, but you know, I read the comments. People are really concerned about breast implant illness. And I think I did mention that my doctor, you know, came right out and talked to me about it. I also watched a podcast from Dr. Anthony Yoon about breast implant illness, and it's really thorough. So I'm going to link it for you, just so that you can go and watch that and, you know, be educated about that. because I am not the one. But I do think it's super important to be informed of the risks. And it's not a decision for everyone. It's not something that everyone wants to do, and that's fine. I'm not telling anyone that they need plastic surgery. I'm not advocating for plastic surgery. I'm not saying that anyone's body isn't perfect exactly how it is. I mean, all bodies are good bodies. And I do love my body how it is. I just would like to enhance it. And that's what I'm going to do. So I am 4 weeks away from my pre-op appointment. And I'm very excited about that. But also I feel like I'm kind of like down to the wire. I have to work as much as I can and like save up as much as I can so I can pay the rest of it. And it's just like a lot of stuff. I was shopping for bathing suits, and even like if the bathing suit fit me perfectly everywhere else, there was nothing. Like the top was gaping because there's nothing there to fill it in. And all of the bathing suits that I already have, because I kind of have a bathing suit problem, trying them all on before a trip that I went on earlier this year, there were 2 or 3 where the tops actually fit me. I think 2. And that was like really depressing because I have like a lot of really cute bathing suits. I like to be able to choose, you know, a selection. And even like the one pieces that I had were still very loose up top. And I guess I've just become not proportionate. So I don't know. I don't know why I'm trying to justify it. It's my body. I can do whatever I want. I became a mom very young. And I feel like my body didn't get to... Like, I didn't get to experience my body looking the way that I wanted it to as an adult. And as a confident adult. Like you don't even get confident, I feel like, until you're in your 30s. Like, 30s are the best. But, and I would like to enjoy my body looking nice and looking good in clothes and feeling good about myself, you know, while I can. I guess I'll check in when I think of something else. And I will try to insert some pictures maybe of what I'm looking like now. Or maybe I'll just wait till the procedure is done. I can do before and after. I don't know. Okay, I remembered the other thing. So, I was very curious because the implants are going to go under the muscle. I was very curious about exercise. And specifically chest exercises. The program I'm on right now is push-pull legs. So push is, you know, super chest heavy. And so I called the office. I spoke to the patient care coordinator, who's super nice. And she said that she would recommend just about like the week before surgery to hold off on any chest exercises. But not to like worry until then. So I've got like a month, yeah, I guess. I don't know. Today is April 5th. My pre-op appointment is April 29th and the surgery is May 12th. So I've got a little over a month until surgery. And So like 3 weeks or so till I need to like chill with the chest exercises. And I also asked about should I be taking any kind of pre-surgery like multivitamins that, you know, they sell these things that are supposed to like get you ready so you're optimal health for healing. So she said to actually just take a look at the list of medications to avoid or to like stop taking the week before surgery. And that's kind of like more what to be worried about as opposed to taking any vitamins right now. Though I did feel like I was getting sick. At this point, I think that it's allergies because if I use Nasacort, I feel better. But I thought I was getting sick. So I got vitamin B complex, vitamin D, and coldies. and the B complex has vitamin C with it. And I'm going to have to stop taking the B vitamins before surgery because they have niacin in them. And that was one of the things that you have to stop because of what it does with your blood. They also told me that they will be giving me vitamins at my pre-op appointment to start before surgery and continue after, that are supposed to help with healing. So that was nice. I'm not really sure what to expect for the pre-op besides trying on the sizers and, you know, discussing that with the doctor again, paying the rest of the balance for the surgery. I don't know. That's all that I know is happening. I imagine we're going to go over a lot of stuff. I will try to film during that, or at least get some video of me trying on the sizers, because I think that that'll be really fun. That's something like a lot of these videos don't show. I'm like, I want to see that. I want to know. Like, even pictures. Like, give me some context. I know everything's going to look different on other people. But, like, it's fun to watch. It's fun to see how these things look different on everyone. And it's nice to have, like, some context, basically. So, I guess I'm going to go edit these things together. And hopefully it's not already, like, more than an hour long. Because I don't need really to make a feature-length film about a breast augmentation and lift. But I could, I guess. We'll see. Okay, all right, bye for real. Well, it is my pre-op appointment today. It is April 29th, and I am so excited. I get to go in and try on all these sizers. I don't know that I'm taking my big camera in. So maybe I'll be able to get, I don't know, something with my phone camera. I'll at least get pictures with the different sizers in, and then I will check back in afterward. The Karen Reed trial, like retrial, is going on right now, and it's kind of consuming my whole life. I feel like the prosecution is putting on a better case so far, but they have a very, very long way to go to convince me of guilty. And, I mean, I'm a law nerd, guys. So, oh yeah, what does it say? Okay, here's my boobies from the side, or my lack thereof. No boobies. So, 2 more weeks of little boobies. I'm so excited. All right, I will talk to you guys later. Hello everyone. I didn't get a chance to update right after my pre-op appointment because I just started doing other things, had to be places, and it is now Saturday, May 3rd. My pre-admission testing is on Monday, so I wanted to let you know kind of how the pre-op appointment went. I got to try on the sizers, and that was a whole lot of fun. I will insert some pictures. When I went in the room, the nurse had set out. She gave me 2 different sports bras to try. I only tried the one smaller one, and I still felt like that wasn't quite tight enough. But the other ones they had were like way smaller, so I was like, mm-mm-mm. So she set me up with the 550, 600, and 650 size, gel sizers, but said that I was welcome to try any of them. She had like 2 briefcases full of them. She said she didn't think I was probably going to go bigger than that, that probably 550 was going to be where I wanted to be. So I tried them on. I started with the 550, and it looked very natural. It looked nice. And if that was the look I wanted, it would have been a great choice. They looked super, super natural. Not very big, just like just natural, normal boobs. Like no one would ever guess that you had a boob job. But we know that's not the look I'm going for. So I tried on the 600 and I was like, these look really nice. Like I put on a crop top. I thought it looked so, so cute. But then I was like, okay, people always say like, if you're wondering, if you're on the fence, go a little bit bigger, especially because you're going under the muscle and the muscle's gonna kind of smush that implant down. So it's not going to be quite as full as these sizers are. So I tried the 650, and 650 was also really nice. Like I really liked it. And the nurse came in at that point, and she's like, "How we doing?" And I said, "This is the 650. I thought 600 looked nice, but I think this looks nice too." And she said, "I thought those would be huge on you, but it's really not." I said, "I know, I'm very broad, like across here. Like I always have been. And it's not something that you can, I guess, really tell looking at me. I don't know. But I mean, my entire life I've been getting caught in shirts because I'm very just broad, across my chest. And even with, negative boobies, I still get stuck in shirts, and it's not because they're tight around my chest. It's because I'm just broad, So I said, I didn't try the 700s, but I kind of want to. And she said, go ahead. You can go ahead and try them. And I will talk to the doctor and see if those will even fit in your body. So she went out. I put the 700s in, and I was like, guys, those are great boobs. They looked great. I did have to keep pulling the sports bra up and just like smooshing them up because it was a really stretchy sports bra and the weight of the sizers was just like pulling them down. And I was trying to compensate for the fact that I'm also getting a lift. So I'm like trying to visualize how they're going to look like with the lift, with the implants. So it was a little tricky. Then, the nurse came back in and she's like, she's still with a patient. But I'm going to ask her that for you. Those look great on you. Like, I feel like it suits you, but we have to see if that will even fit in your body. So she goes out again, and I hear her talking to the doctor, and I hear them like right outside the door. And so they knock and they both come in. And she's like, "Hi, it's great to see you. That looks great on you. Like, you would think it would look really big, but it doesn't. It really balances out your hips." And I said, "Thank you." Like, I thought so too. And she said, "I had a patient that I put 800s in, and that sounds crazy, but it suited her." She said, so like, she said we go ahead with the 700s, but to have 650 available just in case the 700s just didn't fit, because she, quote, doesn't want to kill my nipple. And I really don't want her to kill my nipple either. She said that with a lift, they do have to remove tissue. When you are going with a larger implant and a lift, sometimes because it's larger and they have to have the skin and the tissue to cover the implant, they can't lift the nipple up quite as high as they would with a smaller implant. And I said, that's totally fine. She said it wouldn't be quite like, what did she say? Like midline here, but it might be just a little bit lower. And I said, that's cool. That's fine by me. And I signed a whole bunch of consent forms. We went over everything. The nurse answered all of my questions. She said I should be able to take like my antidepressants and my birth control the morning of surgery, because I have to take one of the meds the morning of surgery. They gave me my prescriptions. My insurance actually covered all my prescriptions, which was awesome. They gave me these vitamins that are supposed to aid in healing. They have arnica and bromelain, and they said to start those 2 days before surgery, 2 capsules 2 times a day, and continue like the whole course of it. Okay, something else that she said. She said that she actually had the same surgery. She's had several rounds of breast implants. But she's also had the lift. She said every hour to like try to lift my arms up and like move them around. She said at first, like, I won't be able to lift my arms very high up because of the tightness of the muscles. Like I just won't be able to. But she said like every hour to just try to like stretch and move your arms around, walk around. And she said by like day 5, she had her arms all the way up over her head. So I thought that was really helpful, really encouraging. She said that a lot of people can do it without needing the narcotics. And I told her that after the birth of my oldest son, they gave me Percocet and it made me throw up. So I was concerned about taking anything like that. And she said, like, she would ask the doctor about that also. And I asked about the nerve blocks, because the doctor does nerve blocks during the surgery. And I guess I was concerned about how long the numbness from the nerve blocks lasts. So she asked for those questions. She came back to me. She said the nerve blocks generally tend to last until the night, you know, right, like after the surgery. And then after that, I should just try half of one of the narcotics along with the Zofran, because they did give me a prescription for Zofran for nausea, and I've never taken that before, so I don't know if it'll help. But she said to just try half, and hopefully I won't need much more than that, other than that like first night and maybe the second night, and that I'll be able to manage with just like Advil or Tylenol and the other, you know, things, the other medications. I really should have grabbed them and brought them in here. What else? Oh, funny thing, I totally like was thinking about the wrong place. I thought that the surgery and the pre-admission testing were going to be in a completely different building, like on a different street. and I was driving from the pre-op appointment over to Target, and I saw a sign that said surgery center, and I thought, I didn't know there was a surgery center right here. Is that the one? So in Target, I called the doctor's office back and I was like, which surgery center am I going to? Turns out it was the one that I just saw the sign for. Which is, it's a good thing that I know that, that I figured that out and didn't just totally end up at the wrong place, like on the other side of town. Because that would have been really bad. Yeah, I don't know. I ordered myself a nice little neck pillow because she said I will have to sleep sitting upright for at least a couple of days. I can start driving afterward whenever I feel up to it. She said some people feel great and they like drive themselves to their first post-op appointment at 1 week, and other people still don't feel great about driving and they have someone else drive them. She said like she had 3 kids. She was driving by like day 5 because she just had to do stuff. She said it was painful, but she just had stuff to do, which I totally get. And I'm afraid that I might end up in that same spot. But hopefully not. Hopefully I'll be able to just relax, heal, and not be in too much horrible pain. Like, I've had unmedicated births 2 out of the 3 times. The first one, like, I had a horrible episiotomy and tear and all the stitches. And it was very, very horrible. So I feel like I've had decent amounts of pain before. I've dealt with decent amounts of pain before. So I know that I can manage it. And I know that I'm going to feel way better about how my body looks afterward. I did figure out this past week the body, like, shape or look that I want for me is had to buy her boobs because she's athletic. Like, that's the look that I'm going for. So, I mean, I've got a lot more weightlifting to do to get there. I think I'm on my way, but that's the kind of look that I want. Like, she's strong, so she had to buy her boobies because she worked out so much that her boobies disappeared. you know, stuff like that. Okay. Yeah, I'm gonna, I guess, wrap this up. I'm gonna try to put in pictures. I took so many pictures, but I don't know how well it's gonna work out with me inserting them in here. I am just in my bum clothes right now because it's cold. It's cold and rainy. So, I think that's it for now. All right. I will talk to you guys later. I can't believe it. I can't believe it. It's just like a little more than a week until my surgery. I'm so excited. All right. I'll talk to you guys later. Bye. Hello, everyone. I am 2 days from my surgery. It is Saturday, May 10th. And I just had to start taking the vitamins that they gave to me. It was take 2 pills twice a day, starting 2 days before surgery and continuing the whole bottle. So I will show you. Okay. So they're called Silogen. Well, that's the brand, the manufacturer. I believe they also make the Scar Gel that I will get after surgery. So this is an arnica bromelain complex rapid recovery system. And these are gigantic. Like, I will show you, they're huge. Why can't I do this? Focus. huge. That's a gigantic pill. And I have to take 2 of them twice a day. And yeah, they're huge. So those are supposed to aid in healing by reducing swelling and pain and bruising. So we will see. On Monday, I went to my pre-admission testing. I was the youngest person in the surgery center waiting room, which was packed, by the way. They took me back. They weighed me, asked me my height, took my pulse ox and blood pressure, went through family history, went over the forms that I filled out, any allergies, I don't know, just all those kinds of things. She asked me to open my mouth, but she was just like real fast. She's like, now open your mouth. And I was like, she said, okay. like what was the open your mouth? What were you looking for? And how could you see if I did or did not have that thing that quickly? Like, you're just making sure that I'm able. It was really funny. She did say that I will likely have to take out my jewelry. So that's pretty lame. Earrings too. Earrings I'm not too concerned about. But like it's so hard to get these to stay on, you know, for a decent amount of time, and now I have to take it out. And this one's been hanging in there, you know. It hasn't like hopped out of my face yet. So I'm like starting to feel a little bit nervous, like just right now while I'm filming. I was not before. So I'll be okay. My best friend is coming with me. She's going to be my responsible driver. We were talking about it a little bit ago, and she said that I said I want to ask the doctor if she can take pictures of when I'm done, but like not like wrapped up yet, like right after it's done, before it starts swelling up and looking crazy, just so I can see. And she's like, I think that's a totally reasonable request. I want her to take pictures during the surgery so I can see your chest muscles. I was like, oh my gosh, you can ask her. So I think she's gonna ask the surgeon. It would be cool. I don't know how I will feel seeing pictures of my own body being operated on. Like I kind of want to. Like I kind of want her to film it. But then I also feel like watching it might make me throw up or something. I don't know. But I mean, it would be nice to have the option, you know, like it would be there if I wanted it, you know. I don't know if she will. Okay, so they said that to shower or bathe either the night before or the morning of surgery, whichever is easiest. I asked her about using any kind of special soap or antibacterial soap, and she said different surgeons have different guidelines and different levels of, you know, like comfortability. I don't know if that's a word. About like that kind of thing, you know, about the different ways that they manage infection risk. So I thought that was interesting because a lot of videos, not all of them, a lot of the videos I saw, people were instructed to wash the night before and the morning of surgery with the HibaCleanse antibacterial, antimicrobial cleanser. And I mean, to me that does seem like a lot. Like there's bacteria that live on your skin for a reason. And I feel like disturbing that much, like if you don't need to. I mean, my surgical area is just limited to here. So, I mean, they're going to clean and disinfect everything before they start anyway. What else? I have to stop eating and drinking 8 hours before I am told to arrive at the surgery center. So they did call me yesterday and said that I need to be there at 7 a.m. Clear liquids, I can have up to 20 ounces before 2 hours before I'm supposed to be there. But that last hour, like, I would have to stop drinking clear liquids at 5 a.m. because I'm supposed to be there at 7. But from 4 to 5 a.m., I'm limited to 8 ounces of clear liquid. And so I guess I'm just having 8 ounces of clear liquid because I'm not getting up at 3 in the morning to drink water. I mean, I might naturally just through the night, I do that, but and I'll be able to take like my regular medications, you know, antidepressants, birth control, that kind of stuff. I'm also supposed to take the Celebrex 2 the night before surgery, so 2 tomorrow night, 1 the morning of surgery, and then I think twice a day following that. Do I have that paper? I did ask the nurse at the pre-admission testing about what the Celebrex is for, and she said that it's to help control the pain and inflammation, and that studies have shown that taking it before surgery can actually help lessen like the overall amount of pain that is experienced, and it just, I guess, is just to help you get ahead of the pain before it happens. My youngest son just had a dental procedure yesterday and had to go under general anesthesia, and all of my kids have had some kind of procedure where they've had to go under. And so I was like, I'm familiar with it. But he was just crying so much after, and like when he was coming out of it, and I'm like, oh gosh, that's gonna be me. That's gonna be me on Monday. I'm just gonna be crying and emotional and maybe vomiting, you know, because that seems to just be my body's go-to reflex for things. But I'm prepared. I've never had surgery before. It's pretty crazy. But I'm really, really proud of myself that I've made this happen. Like, I have, like, raised the money. I've earned the money and paid for it all myself. Like, that's amazing to me. And it's, like, really kind of motivational. Like, now I know that I can do that. And I know that, I mean, I always knew that I could accomplish the things that I really wanted. Things, you know, I could work for and earn anything if I really, really put my mind to it. But this was almost like easier than I thought it would be. And it gives me hope for the future that I'll be able to like really do good things for my family, to get the like home repairs and stuff like that we need, and not have to like try to go the cheap way or DIY, as you know, things that we probably shouldn't DIY, to like do things the right way, you know. So, man, my lips are chapped. All right, so I guess I will talk to you guys later. This is so crazy. I guess the next time you will see me is probably the day of or after my surgery. All right. Bye. Hello, everyone. I am 1 day post-op. I could not film anything yesterday. I was so out of it. But I wanted to give you an update, tell you, the whole surgery experience. We got there. My best friend took me. And she, like, seriously, is the greatest person in the whole world. She took such good care of me when I was coming out of anesthesia. They took me back, took my vitals, took, put in an IV, which I was so terrified about the IV. Like, literally the day before, on Sunday, I had an intrusive thought about them putting an IV in the top of my foot, and it immediately made me want to vomit. And I know that's totally weird and not practical, but, like, you can't control your intrusive thoughts. That's why they're intrusive. But the nurse was really great. She asked me about my experience with IVs. Told her, like, they're not great. Like, the last time I had an IV was when I was in labor with my second son, and they literally stabbed me 4 times in each arm. And my arms were so bruised after. It was horrible. So I showed her, like, I was like, I have good veins. Like, I know where they are. And I was, like, pointing them out to her. And she was like, well, what about over here? What about, like, near your hand? Like, and I said, I have a really good one. Really good one, like, right below my thumb. And I guess you guys, can you see the little dot where it ended up? I was like, I have a really good one right there. I felt it the other day. And she's like, great, that's awesome. Well, I'm going to use that one. Or she said, can I use that one? I said, yeah, use that one. So she got it all ready. I didn't look because I can't. And it was pinchy, but it was okay. Then she started the fluids, and it made my arm so cold. Like, to the touch, it was really weird. Then she let my best friend come back. Like, after I was, changed into a gown and everything. She let her come back, and we just hung out for a little bit, and it was like probably 7:30 at this point. The anesthesiologist came and talked to me a little bit. Then one of the nurses that works with the anesthesiologist also came back and introduced herself. And then another nurse that works with the anesthesiologist came back and introduced himself. And I thought it was really nice that, like, everyone who was going to be in the room with me came and introduced themselves and, just said that they were going to be there. They're going to be helping out. I thought that was just really, really nice. Just to know the people that are going to be around you. Then the doctor came in, and she marked me up, and you can see I tried to wipe it off a little bit, but it's still there. So she marked me up, and then they wheeled me back. I got up on the table. They had, like, all these pillows for me to put my legs up on, which I thought was weird. But I don't know, I guess that's just what they do. And they had me put my arms out on the arm boards, and they put the little breathing mask over my face. And I was like, they're like, all right, think of a good dream. And I was out in, like, less than 2 seconds. Like, I was just out. And it felt like I took, like, a nice, decent nap. I know a lot of people say that it felt like it was 2 minutes or 2 seconds, but mine felt like it was, like, a decent nap. I didn't feel really groggy when I came out, but I was just, like, kind of foggy and out of it. Like, when they first woke me up, they asked me what my pain level was, and I'm like, about a 2. And then I was just, like, getting really dizzy and nauseous, and I just, like, kept closing my eyes. Like, I just had my eyes closed most of the time because opening them just made me feel so sick. So they helped me get off the bed and back into the little wheelie chair and wheeled me back to my room. And I just kind of passed out there a little bit. And my best friend was feeding me ice chips and sips of water because they really wanted me to try to get something in me just to make sure I could keep stuff down. I could not. I was just vomiting and vomiting and vomiting. It was horrible. Like, I could not stop puking. And then I was like, I know I have to pee. So they took me to the bathroom, and my bestie stayed in there with me because she is just the greatest person in the whole world. And I just couldn't pee. Like, I couldn't feel anything. Like, I knew that I had to pee, but I, like, couldn't feel anything. It was really, really weird. So I, like, couldn't pee. The nurse kept coming in and, like, asking how things are going. I'm like, it's not going. And then she, after like the third time she came in, she's like, I'm gonna go call the doctor. Like, okay. Because we were trying like the running water and everything. And I said, well, I wish there was like a squatty potty in here. I feel like that would help. And my beautiful, wonderful best friend got down on that stinky bathroom floor, and she held my feet up with her hands. And that did help a little bit, but I still couldn't pee. So they're like, the nurse came back in and she's like, all right, well, we're going to get you up and walk you back to the room. I want you to be able to walk. And I stood up. I was like, I'm going to vomit. They brought me a basin and I started puking and puking. And I was like, I'm peeing. It was really terrible. The nurse was like, you are? I said, yeah, I'm peeing down my leg. So I like sat back down on the toilet, continued to barf and puke, or, barf and pee at the same time, which is, just lovely. But it was rough. Coming out of anesthesia was rough. And they gave me Zofran from my IV and some other thing, like nausea medication through my IV. Then they put this like patch behind my ear, which is still there because they said it can last for like 48 hours or something. So they like tried all the things. They gave me a shot in my thigh of epinephrine, like just trying to get me to feel better. And I was just not feeling better. I had ice pack on the back of my neck, ice pack on my forehead, had warm blankets on my body. Like, it was really rough. And the nurse just kept telling me, well, either you go home and, try to handle this at home, or you get admitted to the hospital because you can't stay here. Like, I don't want to go to the hospital. She's like, you can't hold anything down, you can't walk, you can't pee. And that was, before I did. But she just kept telling me, well, And she talked to the anesthesiologist and came back and basically said the same thing, that I can't stay here. I can go home, or I can go to the hospital. And then, after she talked to the doctor, same thing. You can go home, handle it at home, and, you have the doctor's personal cell. If anything goes wrong, you can call her. So I was like, I want to go home. Like, I don't want to go to the hospital. So my bestie, she's like, let's get you dressed so we can go home. Do you want to put some panties on? I said, yes, please. And she like literally dressed me like I was a 3-year-old. So that was really sweet. She's just the best. This is really a story about friendship, not breast implants. So, the doctor said that I chose the perfect size, that the 700s look great, and then she texted me later and she said the 700s are perfect, surgery went awesome. So I thought that was really nice. I started to feel better after I was home. And like later in the evening, I was able to eat some peanut butter toast. So like we got there at 7 a.m. We did not leave until after 3. Because I just like was so sick. And the surgery was supposed to be 2.5 hours. I don't know how long it actually took because I was just so out of it. Like, time was nothing to me yesterday. Time did not exist. So I was pretty like just out of it when I got home. I like kind of dozed and slept while, on the drive. I couldn't keep my eyes open. I I only threw up once in the car, so I thought that was pretty good. We had those like little puke bags, so I thought that was pretty good. Only puking once, and I didn't puke at all after being home, but I think everything was out of my system, and what I was puking was just like water and all the medications that I had, and it was just so bitter and awful. And that's probably like too much information. Like, you guys don't need to know about me peeing and puking, but I want a real experience out there, you know? My best friend kept saying that they looked great, even though they're swollen. They're still very swollen. It felt like I had a softball in my armpit because it was just so swollen. And it's still very swollen here, but there's no softball in my armpit anymore. So I will show you what we have going on here. Oof, if I can unzip. Okay. So, oh gosh. Here is our lovely surgical bra. My boobies are all the way up to my collarbones. You can see there's still the markings on there that I tried to wipe off. Got some gauze pads in here. Just big giant boobies. And you can see the swelling. Oof. Like, oh, look at that. Oh gosh. So I think it's definitely better than it was yesterday, but it's still rough. They told me to move my arms around once an hour to try to like loosen up the muscles a little bit, and to get up and walk around every hour, hour and a half or so to prevent any blood clots. I have to leave this on for 2 days, and then I can shower. I can throw away the gauze. They said if I had any like leaking or whatever, like the fluids from healing, then I could put more like gauze pads in there, or a panty liner, it said. So we'll see. I'm not really sure. I'm very curious to see them not all bandaged up. And I would like them to, you know, not be all the way up at my collarbones. But, you know, I've just had them for like 30 hours, so. They're brand new boobies. So swollen. Oh, gosh. This one is so much worse. And it's my left side. And my partner said, it's probably because your muscle's bigger on that side. And I said, you are absolutely correct. I am so much stronger on my left side than my right side, so I'm wondering if that's why the swelling is so much more, and like so much more bothersome, painful. The pain was pretty rough yesterday. Like the muscles between my shoulder blades, like it felt like I did a million heavy deadlifts. Like it was just so sore. All the way around me was just so tight and so sore. Now, like, I did sleep last night on like I have a wedge pillow, and I actually slept. I was up several times, but that's like kind of normal for me. But I did sleep, and I'm so happy that I have good core strength, so I don't have to use my arms to get up. Because like my arms right now, my muscles, like I just can't. I couldn't even open my prescription bottles, you know. I have to ask for help, and that makes me feel really weak, you know. But I know, like, it just hurts. Like, it's just too tight. I can't use those. I have to keep switching the camera from one hand to the other because it's tiring. Gosh, they're giant. Look at them. Oh my gosh. So, so I am, for the pain, taking Celebrex, gabapentin, and Tylenol. I'm trying really, really hard to avoid the oxycodone because I looked it up and Percocet is oxycodone plus acetaminophen, which is Tylenol. And Percocet made me vomit, like the one time that I had it. I've never had it since, and I'm over the vomiting. So I'm hoping that I can just avoid it completely. I'm hoping the pain doesn't get worse, as days go on, but I've heard for some people that it does. So I'm just gonna see, and I guess if the pain gets really bad, maybe I'll take a half of one with a Zofran like the doctor recommended. But I really don't want to take one. I really don't want to vomit. So yeah, here's where I am. My bestie braided my hair. She's so nice. She got me a little gift from Target with like the Pacifica like deodorant wipes and stuff since I can't shower. Which I thought was really sweet. I love those wipes. They come in handy. I'm excited to see how it changes each day. I mean, it's already super improved. Like, it no longer feels like there is a golf ball in my armpit. Kind of feels like or a softball. Kind of feels like there's a softball right here, but, at least it's not in my armpit anymore, because that was really terrible. And I just keep, like, massaging the fluid, like, trying to get it to drain. Oh, yeah, they gave me 2 liters of fluid through my IV. 2 liters. I weighed myself this morning. I am 7 pounds heavier today than I was yesterday. Like, oh my gosh. So, hopefully, most of that is water weight, and it will go away. Some of it's boobies, but let's hope that a lot of it's just the swelling and it goes away in a couple of days. Yeah, I think that's it. All right, bye. Hello everyone, I am on post-op day 2. It is Wednesday. I was feeling pretty sore this morning. Yesterday I accidentally picked up my toddler and put him on the toilet. And it was just like an instinct, like a reflex. It was just like, pull pants down, put kid on toilet, And it hurt so bad. So I'm sure that's why I was extra sore this morning. I'm just kind of hanging out. I am really sleepy, and I'm wondering if it's because of the medications. I guess the gabapentin can make you dizzy or tired. So I'm guessing that's what that is. I don't know. They've been making really bizarre bubbling feeling. Just like air bubbles, like moving around inside my boobs. It's really strange. I get to shower today. I'm so excited. I'm excited to take this bra off and see what they look like. I know that, when it's all healed, they're not going to still be all the way up here, because that's insane. Hello everyone. I got interrupted last time I was filming. All the children came home, so I had to put the camera away. And so now it is Sunday, meaning I am 6 days post-op. So almost a full week. My mom did my hair again. I did get to shower. I've showered a few times now, but I'm just getting so greasy, and I don't know if this is from all the medications, like trying to filter out of my body, or what, but my face is getting so greasy. It's just really weird and gross. And the past, several days, like yesterday was my last day with any prescription medications. And I think I just had 2 Celebrex left yesterday. The day before was my last day with the gabapentin, and I'm so glad that I was done with that because it just made me so foggy and like my vision was blurry. I couldn't feel stuff. I didn't think about it until my best friend pointed it out that it is a nerve blocker. So I'm like, guess that makes sense. And really, like yesterday, I felt pretty good. Like I just and today too. Like yesterday I got up and I took ibuprofen and Tylenol and the Celrex. And that was it. I didn't take ibuprofen and Tylenol again until I went to bed because I was fine all day and then my kids started being absolutely wild. Like wild animals, and it was time for bed and they just started getting really sore. So I took Tylenol and ibuprofen and went to bed. This morning I just took Tylenol and that was it. And I've been pretty good. It's 3 o'clock in the afternoon. A lot of the swelling has gone down. They're still very, very high and very, very square, but it no longer feels like the whole implant is in my armpit. And you can see there's starting to be some separation in between them. I do have non-stick gauze pads in here. They are not seeping. They were. I was having some drainage, mostly from my right one, which is really weird. The right side, like, hasn't been nearly as sore as the left side. It has better range of motion. It also has way more bruising and was like seeping a lot more. Like the left side barely has had any kind of drainage at all. The thing is, it's just, I don't know if it's the incision tape itself or if it's from like sweat or something. I don't know, but the tape keeps getting stuck. Like the underneath tape for the incision keeps getting stuck to whatever is touching it, including the non-stick gauze. So it just, I've just been making sure to change it out and being really careful with that so I don't pull it off. My first post-op appointment is on Tuesday. So we will see what they say then. I have been using ice and heat on and off. I haven't used ice in a couple of days. Just the heating pad. And then I read like online that maybe you shouldn't use a heating pad. You have to talk with your doctor first about using a heating pad because you could burn yourself if you have any numbness. I don't have any numbness. I have feeling in my breasts, like even my nipples. I was really afraid that I would lose sensitivity in my nipples, and I haven't. They're like, I can feel them. So that's good. They do look scary. They look really huge and square up here. And then there's my like gnarly Frankenstein nipple and the incisions and like my normal breast tissue underneath. It's really weird. But I know it's a process. I know that it's going to take a few weeks and then they're going to start to drop down. It's really wild to see them. Like, my gosh, that's crazy. I have been sleeping upright, kind of upright, on like a wedge pillow. And I start sitting mostly upright, and by the time I wake up, I'm like scooched way down. So I'm just glad that I have a good core, like good core strength. So I haven't had to even accidentally try to use my arms to get up. The one thing I did was the first day post-op, I accidentally lifted my child onto the toilet. And I don't remember if I said that already, like the last time I filmed. But oh gosh, that really, really hurt. And I wonder if that is what contributed to a lot of the drainage initially, was that I just like really strained myself. I had my mom braid my hair again yesterday because it was just being a lot. It's like got these weird, like, it's doing weird, like, Pippi Longstocking things. But because my face feels so oily and greasy, it was making my hair feel like it was just like getting on my face more. And I don't know if it actually was, but it just was irritating. I got these nightgowns. They're super nice. Like, they're so soft. They're cheap on Amazon. They did send me, like, I wanted a purple one, and they sent me it's like a really deep navy color. The buttons are purple, but the nightgown itself is not purple. Because it is hard. Like, I have pretty good range of motion. Like, this is my right arm, and I can get pretty good range of motion. My left arm is the one that's been much more restricted, and I can get, that's pretty close. What's been really painful with this side is putting my arm back. So it has been difficult, even with button-up clothes, to, like, get my arms in. It took me a while to figure out, like, oh, maybe I should just put that arm in first. And then, swing my right arm back around because I have better range of motion with that one. But even, like, trying to put a blanket around myself, trying to put the towel around me after I get out of the shower, just that reaching my arm back like that, like, was very painful. But I think I've turned a corner. I think it's getting much more comfortable. If I'm sitting down, like, I can't even, like, I forget that they're massive. Woke up this morning and I didn't even think, like, it didn't even feel like they were up here, It felt like nothing had happened. Of course, they are up here. They are way up at my collarbones. Let's see what else. Something, I haven't heard anyone else describe it this way. I've heard people say it's really tight. It feels like there's, like, bricks on your chest. It feels like you did a really heavy chest day or, like, lots of bench presses. It feels like my boobs are pregnant. It feels like I have 2 pregnant bellies on my chest. It's, like, exactly like how my belly felt when I was pregnant. And I get very hugely pregnant, so I'm wondering if that's why. But just, like, the skin feels tight and sensitive. When I stand up, it, like, just feels heavy, and like the muscle you can feel, like, tighten up, like Braxton Hicks contractions. Like, it feels like my boobs are pregnant. It's really, really weird. And I think it's also weird that no one else has described it like that, because I can't be the only person whose pregnant belly felt that way, or whose boobs felt this way. But also, I'm finding that not a lot of people who have made these videos have gotten as large of implants as I got. I did go with the 700s. I don't know how much I got to say even in my last video. I went with the 700s. The doctor said that they are perfect. The surgery went great. I chose the right size. So I'm really happy with that. It's just kind of sensitive. Like, I can't stop touching them because I feel like, I don't know. I think subconsciously I feel like if I keep touching them, then it'll improve faster. That's probably not right. I'm probably just, like, making things more uncomfortable for myself. I don't know. But I am very proud of myself that I did not take the oxycodone at all. I didn't, it didn't get to the point where I felt like I had to. Those sometimes were very painful. I don't think my pain level ever went really past a 6. But again, pain is subjective. So like I've given birth twice unmedicated and decently long labors. So I feel like that makes a difference. My incisions don't hurt. Every once in a while I get this pain right here. There's no incision there. It always makes me think like, oh my gosh, am I like ripping my incision open or something? I think it's like the end of the muscle or a nerve because there's no incision there. That's really the side of my boob, and I'll get like a really sharp pain there that feels like it's pulling. But everything is good. Like nothing is bleeding. Nothing is oozing. Like I had a tiny itty bitty bit of drainage yesterday. Or before that was much more. But like by much more, I mean like maybe like a quarter size amount. Like it's not a lot. But like maybe a dot on the gauze, Today I've had nothing at all. Yesterday I had like a little tiny dot. That's it. So I think things are going pretty well. I'm gonna try to get these photos together and edited in a way that maybe is YouTube friendly. I want you guys to be able to see like the bruising because I feel like you don't get to see that. Like no one's showing the bruising, no one's showing the incisions, and I feel like that's important. I feel like that's an important thing for people to know about before they go into a surgery. Like, what is it gonna look like? I don't know. It made me feel prepared. They're getting much softer. Like I can feel some give to the implant a little bit. Even though they're still way up in my chest. I see the improvements little by little each day. I don't know. I haven't really experienced the shortness of breath that a lot of people have said that they had. I don't know. I got my new glasses from Zenny. Aren't they cute? I put the anti-glare, like I asked for the anti-glare lenses, but they kind of have a lot of glare compared to my old ones. But the old ones, I got from like my actual eye doctor and not the internet. I haven't tried to really go out of the house. I haven't tried to drive. I'm just not. I want this healing to go as smoothly as possible. I even have like all my pills in a like little pill organizer thingy so I can just pop the lids off because like I couldn't even open my baby gate, like unlatch it, because you don't even know how much you use your chest muscles for. Like they're just involved in everything. And that was like the hardest thing, I think, was realizing the amount of things that I could not do. That's rough because like I am rather independent, and I told my best friend, like, I felt like I was in helpless baby mode. She's like, you had surgery, you were on drugs, like meaning like immediately right after, and like this whole past week was the most medications I've ever taken in my entire life. Wild, like way too much. Not a fan. It's so much to remember. I don't know how people who have health conditions that require them to take that many pills a day every day for their whole life. Like I cannot imagine. Like it's a lot. It's so much. So it's been an interesting experience. I can't believe that I actually did it. Like, I actually have breast implants. That's really funny to me. um, I don't know why. I don't know why it's funny, but it is. See there, there's like a little stabby pain there. Um, I don't know. It's really interesting to me. I made the comment yesterday that even though my face is really like greasy and I'm washing it like a million times a day, that it's actually like really super clear. And then of course like I get a zit. Because why not? You know, could only last for so long. I've been trying to only shower every other day because even though I know it would probably help with my face oiliness, but I mean, maybe not. I don't know. Even though showers feel really, really nice, I think I really overdid it the last time. And I like, because I was like, my first shower post op, I was just like fast. Like, I washed the smelly parts the best I could. I washed and conditioned my hair the best I could. But I didn't like scrub my arms and my legs and everything. I washed the way they told me to, putting soap up here and letting it run down over the incisions. Like the warm water being on them felt so nice. But I didn't like go full exfoliating, and I didn't put lotion on except for like my face after. And the days after that, like just like touching my legs, they just felt so dry. And my arms, like my skin just felt bad. So when I got a shower the other day, I like really got in there and I really scrubbed and scrubbed and scrubbed. And I think that that was a bad choice. Because while it was kind of okay, like using my right hand to scrub and scrub and scrub my legs, when I had to use my left hand, it was painful, like especially leaning forward to scrub my leg. And I like had to use my right hand to like hold on to my boob and like support it because it just felt like a lot of pressure. And I think that's the part that is most uncomfortable for me about showering, is that I am not wearing a bra and it feels like they're gonna fall off. And like half the time when I'm standing up and like walking around, I feel like I need another bra on over top just to like hold everything in. Because like that's what I did when I was pregnant with my belly. I would have a belly band on and then the full panel maternity pants with the full like elastic over my belly, and then I would wear a cami that's like really stretchy and stretch that over my belly, and then my shirt. So I would have like 4 layers of support over my belly because it just felt so heavy and like my skin was going to split open. And that's what it feels like with these giant implants. Like, I feel like I need to have so much more holding it in. But I feel like if I did that, like, because I have a couple of those SheFit sports bras, which I guess are like doctor approved for post-op. I feel like if I just like put that on and just strapped them up, then it might hinder the dropping process. Like, I don't want to hold them up so much that the muscles don't ever relax, you know? I want them to be able to relax and let the implants drop down to where they're supposed to be. I saw a post, I believe it was on Real Self, which is a site where you can ask plastic surgeons questions. And it was like the woman she had my same exact operation, the mastopexy with augmentation under the muscle, silicone implants, and 700cc implants. And looking at her pictures, they looked exactly same shape, same square off into the armpit weirdness, like regular boob down here, big square giant weird boob up here. Um, and so she had pictures at like 5 days post-op, then like 2 weeks, and then like 8 days or something. Or no, 8 days, then 2 weeks, then 2.5 weeks. And they looked pretty much the same until 2.5 weeks, when they finally started to drop down off her collarbones and starting to look a little more boob-like. So like they started like dropping out of her armpits, you know? So I'm going to take that as a good sign. Of course, afterward, I could not find that post again. I don't know why. Like it wasn't in my history. I don't know. It just like disappeared. So I'm just hoping. I'm hoping that I will follow a similar trajectory, or that maybe they'll even start dropping before then. But I'm not going to hold my breath. I am getting more separation in between them. That's how I know like the swelling's going down. Besides the fact that I am now only 3 pounds heavier than the day of surgery, the morning of surgery, than rather than 7. I know that the swelling's going down because it's not so much, you know. My mom told me that they look like those giant steroid turkey breasts in the grocery store. Thanks, Mom. It's so ridiculous. Yeah. I don't know. Maybe I can just show you the bruising the way that I've seen a few people do, which is by doing one of these. So there's my non-stick gauze that is sticking. And I just put this on here just before I started filming. Okay, there we go. Ta-da! Gnarly, huh? So that side's got the worst bruising. Oof. Let's see. This side. And this side's just way more sore to move my arms and stuff. Arm. Oh, come on. Don't stick. There we go. See, got some bruising over there. See, this side's not so bad. So, that's where we are. That's where we are at 6 days post-op. So, we'll see. We'll see what happens. I will try to keep you informed best I can. Okay. All right. Bye. Okay. Hello, everyone. I don't even know if I updated after my 1 week post-op appointment. So I did drive myself. It was my first time driving after the surgery. It was a little scary at first, but then it was like really nice to be out of the house. It made me feel a lot more like a human. And that was Tuesday. And this is Saturday, May 24th. So I am 12 days out from surgery, 12 days post-op. The nurse at the post-op appointment said everything looks good. I'm exactly where I should be healing-wise. She said I can do as much like massage under here as I need to. Let's see. She said to continue taking ibuprofen and Tylenol as much as I need to help the swelling go down. I did not take any kind of pain relief yesterday or today, and I feel pretty good. Yesterday I felt a little bit better than today. Today I'm getting some more like sharp pains. It's the left side, so I don't even know. You can probably tell the right side is starting to go down and it's much more rounded. The left side is still very constricted right here, and that's where I'm getting that sharp pain. It's the muscle. So it's like, it's just really tight right there, and it's not letting, it feels like it's not letting it drop down. And it's, you know, that's where I'm getting the pain. So I've just been trying to like apply some gentle pressure right there to try to help the muscle relax. Who knows if it's helping, but I think everything is pretty good. My bruising is almost completely gone, which is amazing because 2 days ago it was still really bad, at least on my right side. The left side was almost gone 2 days ago. The right side was still very bruised, even though my right side like doesn't ever hurt me at all. The intense heaviness and tightness when I stand up is going away. So that's good. The incisions are looking good. She said that if the surgical tape starts peeling up to just trim it, and she will remove it at my 1 month appointment. And then at that point she will give me scar gel to start putting on the incisions. And she said that's the only thing she wants us putting on, me. It's the only thing she wants me putting on the incisions would be the scar gel. Yeah, I think that's pretty much it. So it's been very, very cold here. This is the first time I put a shirt over my head. I am wearing this like sports bra that had to go over my head. So the sports bras like have been much more comfortable than the compression bras. And the nurse did say I could wear whatever bras I wanted as long as it didn't have an underwire and as long as it was supportive. So even though it was like a little bit painful trying to get it on over my head, and I know it's going to be painful getting it off over my head, it is much more comfortable than the surgical bras. I don't know. Guess that's it for right now. Guess I'm just going to keep making these little short little snippets as I recover. Okay, bye. Hello everyone. I am 3.5 weeks post-op. This is Wednesday. Monday was 3 weeks. I'm really not very good at keeping up with, you know, filming on a schedule. This is where we are. They're still incredibly high. I feel like they've barely dropped at all. Hold on. Okay, this is where we are. They're still like upside down triangles. They're very wide up here and very flat from the side. Like, I think maybe we're rounding out a little bit. But let's see. Still very kind of constricted on this side. So that's where we are. It looks a little weird still. I think this side's going down a little bit more because you can see there's a top, that one here. This one is up here. So the right side is definitely going down faster than my left side. But that's where we are. I haven't been having a lot of pain, thankfully. That pretty much went away like maybe the day or two after my last time I filmed. I did have 2 nights in a row some random pains in the right side, like in here. And that was random because I hadn't had any pain at all in my right side like this entire time. Like some soreness maybe, but not like pains. Since then, when I get up, they feel very heavy. Like I can feel, especially the right side. So I can tell this one's, it's working on it. It's working on going down. Yeah, I don't know. I go on Tuesday, so like a little less than a week, to go to my 1 month post-op, and the nurse said she would take the surgical tape off my incisions then. So hopefully I get to see some like nice clean lines, and I'll be glad to not have the tape on anymore because it is still sticky. Like the tape that's like around my nipples is not sticky anymore. It's like regular, like normal, but the tape that is in the incisions underneath my breasts are still sticky. So I keep having to use those non-adherent pads to keep them from sticking to my bra. Yeah, I can't think of anything else right now, but that's where we are. Okay. Bye. Hi everyone. I am really bad at following up, apparently, because I just spent 2 hours rewatching everything I had already put together, and I didn't even get to 1 month post-op. So real quick, at my 1 month post-op, I got the tapes taken off, and that made me feel way better because the tape had dried blood on it and it just looked terrible. And it was actually really making me feel down about myself. Like sad, like they looked yucky, you know, like not something that I liked, like, you know, not pleasant to look at. They were still very square. Honestly, they did not start dropping and changing at all from 1 month until like 3 months. Seriously. They stayed up very high, like really big, weird pecs. And really did not start rounding out at all until about 6 months. So, my scars look amazing. It's amazing. At my 3 month checkup, post-op, whatever, the doctor said that I was actually healing ahead of schedule, which I thought was really cool. Because honestly, they were still super high at that point. At that appointment, she took the after photos for, you know, like the website or whatever. And I like really wish that she would have waited and taken them at a different time, like later, because they changed so much from 3 months to 6 months. And now I am almost 9 months post-op, and they keep changing and getting more round and softer and looking honestly more boob-like. Because yeah, this is now 2026, and I started those videos in early 2025. Like I'm almost a year to when I had my consultation done at this point. And I really was, like, I started getting nervous when I was looking online at other creators that I really like who got like plastics done. They had lost a lot of weight, and so they got the tummy tuck with the muscle repair and the breast lift and the augmentation. And the amount of negative, nasty, and rude comments, like, made me think, I'm not even gonna put this out there because I don't need that. Like, stuff is hard enough as it is. I don't need people, you know, saying that, I don't know, crappy stuff about about me, you know? But thinking about it, I feel like there's a lot of good information. I feel like I would have appreciated a nice long vlog documenting the process. Sorry about the lack of like photos and stuff like that. I got the sizers in there. Like, I don't know what else to tell you guys. I don't know. It's just been a whole lot of stuff going on. They are looking a lot better. I'm like so slouchy right now. Oof. I should sit up like a grown-up person. I've got my I have questions hoodie on. As you can see, even with a big hoodie on, I have a very nice profile. And so my measurement pre-op was a super deflated 34C. And I am now measuring a 34H. For bras, you have the small band large cup. Understance was fantastic. I love them so much, and I am so sad that they are not in business anymore. Their bras are so comfy and cheap. But they aren't in business anymore. I like Cup, CUUP. Their mesh plunge bra is really nice. A little bit tighter. Like it runs on the more snug side. And if you're not slouching, then it's fine. But you know, slouching around like I am, it's gonna dig into your ribs a little bit. And Soma, I got their stunning push-up, and it's like absurd. Like in a good way, but no one needs that much cleavage. but it's good. I guess I can give you guys a little look at what we're dealing with now at almost 9 months post-op. Okay. This is a bra from Understance, I think. Looks pretty good. You can see I'm getting a nicer slope here. Yeah. All right, we've got this bikini top from Target. I love it. I think it's super duper cute. Fits pretty well. I'm glad that I can fill it out. When I bought it, I did not fill it out at all. So, yeah. So we got, oh, I got a new tattoo. It's Medusa. It says, "Look at me last time." I love it. All right, and here we have the fabled Soma stunning push-up. I told you it is absolutely absurd. No one needs this much cleavage, ever. But, I mean, it's fun, right? It's cute. Whatever. It's a bra. So, yeah, here we are. Ta-da! So, that's where we are. Oh, I got new glasses too. So, I just realized I did not show you my scars. My scars look fabulous, if I do say so myself. So, here you go. I mean, I've got some bra lines, but look at that. You can barely even see it. Insane, right? Ta-da! Dr. Greer is an artist. She's fantastic. Yeah, so that's where I am. They're finally looking more boob shape and less square, and the they're getting way softer, I guess. Like squishier, like more normal-ish. Because for a really long time they're just like really hard, just like stuck on. Something about my surgery that I didn't realize was so rare, I guess not rare, but uncommon, is that my implants are completely under the muscle. So the muscle was not detached from the ribs. It was not cut. Usually when people say under the muscle, they mean dual plane, which is when the muscle is cut, it's detached from the ribs, like here-ish, and so the top half of the implant is under the muscle and the bottom half is out, like not under the muscle. So mine is completely under the muscle, so the implant is completely supported by the muscle, which is why it takes longer for it to drop and get to where it's supposed to be, basically. But the nice thing is then it stays perky, basically. I have gotten back into working out. I have been modifying my push exercises. I think I'll probably do a video about exercise and implants, because so many people are like, no, we just don't ever do chest ever again. And I think that's a little crazy. I don't know. I feel like to have well-rounded strength, you need to be able to push, and that requires your chest. But that's, I guess, if you want to be functionally strong. Who would think that? It does feel weird to do push-ups with implants under the muscle. It feels really weird. Inclined push-ups is like way better, because then you can focus on triceps and it's not so much pectoral. I don't do bench press. I don't have a bench. So I would always do dumbbell chest presses. Now I do them inclined and I keep a neutral grip, and that seems to help. Oh, that can be a separate video. I hope that this was helpful. I'm not gonna put in the gory pictures. You saw my nasty bruises, that's good enough. Eventually I'm gonna do something with them. I took pictures every single week. First I was taking them every single day, and that was crazy. My advice, if you are having any kind of breast augmentation, just don't look at them for like the first 4 months. For real. Like, take a picture when you get home, take a picture at 1 week, and then just don't look at them again. And then when you look at them at like 3 or 4 months, you'll be so surprised. Like, other than that, just don't look at them. Because it gets really disheartening when you are taking pictures week after week after week and seeing no changes at all. So that's my advice. Just don't look at them. Alright, if you guys have any questions, I will do my best to answer them if you want to drop them in the comments. I hope you found this informative, entertaining. It is funny for me looking back at my post-op videos because I was like super high. Like, I was so loopy. The part where I was like, this is really a story about friendship. Like, I love it. I love it. I'm really funny. But it is a story about friendship. No. Alright. I guess I'll talk to you next time.